Chemotherapy is a critical cancer treatment that uses powerful medications to target and destroy rapidly dividing cancer cells throughout the body. It's a complex and evolving field that requires careful management by medical professionals. Chemotherapy drugs work by disrupting the cell division process, which is accelerated in cancer cells. This allows the medications to selectively target and kill cancer cells while minimizing damage to healthy cells. The four-bag and tubing shown in the image are a common way of administering chemotherapy drugs directly into the patient's bloodstream. Careful monitoring and management of side effects is essential during chemotherapy to ensure the best possible outcomes for patients. Chemotherapy is a type of cancer treatment that uses powerful drugs to target and kill rapidly dividing cancer cells throughout the body. Unlike localized treatments, chemotherapy circulates through the bloodstream, allowing it to reach and treat cancer cells wherever they may be in the body. Chemotherapy can be used on its own or in combination with other treatments like radiation therapy, surgery, or targeted therapies, depending on the specific needs of the patient. The image on this slide shows the administration of intravenous chemotherapy with the medical equipment and tubing used to deliver the drugs to the patient. Chemotherapy drugs target rapidly dividing cells, which is a key characteristic of cancer cells. These drugs disrupt the cell division process by damaging the DNA and RNA of cancer cells. This damage triggers programmed cell death, or apoptosis, in the cancer cells. Chemotherapy is a systemic treatment, meaning the drugs circulate throughout the body and affect both cancer cells and healthy cells. The goal is to selectively kill the rapidly dividing cancer cells while minimizing damage to healthy cells. Chemotherapy drugs are an important part of cancer treatment, working to stop the growth and spread of cancer cells. I'll be discussing four main types of chemotherapy drugs: alkylating agents, antimetabolites, plant-derived drugs, and hormonal agents. Alkylating agents interfere with DNA replication, preventing cancer cells from dividing and growing. Antimetabolites disrupt the production of new DNA and RNA, which are essential for cell division. Plant-derived drugs are natural compounds extracted from plants that interfere with cell division and growth. Hormonal agents block or lower hormone levels to slow the growth of hormone-sensitive cancers. Each of these drug classes plays a crucial role in the comprehensive treatment of various types of cancer. Chemotherapy drugs are designed to target and kill rapidly dividing cancer cells. There are several key mechanisms by which they achieve this. Cytotoxicity. The drugs directly kill cancer cells that are rapidly dividing. Cell cycle disruption. The drugs interfere with specific phases of the cell cycle to prevent cell division. DNA damage. The drugs disrupt DNA replication and repair, leading to cell death. These mechanisms allow chemotherapy to selectively target and eliminate cancerous cells while sparing healthy cells that divide more slowly. Combination chemotherapy can create synergistic effects, where the combined impact of multiple drugs is greater than using them individually. Oncologists carefully select drug combinations based on the specific cancer type, stage, and patient factors to optimize treatment. Combination chemotherapy aims to attack cancer cells through different mechanisms, enhancing the overall effectiveness of the treatment. The goal is to target cancer cells from multiple angles to improve outcomes for patients. Chemotherapy drugs are often given through and for, which allows for controlled and gradual delivery of the medication. Some chemotherapy can also be taken orally as pills, capsules, or liquids, providing more flexibility and convenience for patients. For certain types of cancer, chemotherapy may be administered directly into other areas of the body, like the cerebrospinal fluid or abdominal cavity, to target the disease more effectively. The goal of these different administration methods is to deliver the chemotherapy in the most effective and manageable way for the patient. Oral chemotherapy allows patients to receive treatment at home, which can be more convenient, but requires careful medication management. Intravenous, for chemotherapy is administered directly into the bloodstream, often at a hospital or infusion center, allowing for more precise dosing and monitoring by medical staff. Oral chemotherapy gives patients more flexibility and control over their treatment schedule, while for administration may be better suited for certain drug regimens or patient needs. Oral chemotherapy requires careful adherence and monitoring by the patient, while 4 treatment allows for closer medical supervision and monitoring of side effects. Chemotherapy is typically given in cycles, with treatment followed by a rest period to allow the body to recover. The frequency and duration of chemotherapy treatments can vary, ranging from daily to weekly or monthly doses. The timing of chemotherapy is carefully planned to target rapidly dividing cancer cells while minimizing harm to healthy cells. This approach aims to maximize the effectiveness of the treatment while managing side effects. The oncologist will work closely with the patient to determine the optimal chemotherapy cycle and schedule based on the individual's needs and cancer type. Chemotherapy dosage is influenced by a variety of patient-specific factors: a patient's age, weight, height, organ function, and overall health status can impact the appropriate dosage. The type, stage, and location of the cancer may also require adjustments to the chemotherapy regimen and dosage. Other medications the patient is taking can potentially interact with chemotherapy drugs, necessitating dose modifications. The treatment goals, whether curative, palliative, or maintenance focused, can also affect the chemotherapy dosage. Chemotherapy can have significant side effects that impact a patient's quality of life, including nausea, vomiting, fatigue, hair loss, and a weakened immune system. Anti-nausea medications are often prescribed to help manage the nausea and vomiting that can occur during chemotherapy. Extreme tiredness and lack of energy are common, so it's important for patients to rest and manage their energy levels during treatment. Hair loss, known as alopecia, is also a common side effect, but hair typically regrows after treatment is complete. Chemotherapy can reduce the body's white blood cell count, increasing the risk of infection. Precautions and close monitoring are necessary during this time. It's important to be aware of these potential side effects and work closely with a healthcare team to manage them effectively. Chemotherapy can have challenging side effects, but there are proactive steps patients can take to manage them. It's crucial to work closely with your healthcare team to develop a plan for managing potential side effects before they occur. Taking prescribed medications as directed can help alleviate common side effects like nausea, fatigue, and pain. Making adjustments to your diet, rest, and activity levels can also help your body cope with the demands of chemotherapy. By being proactive and making lifestyle changes, patients can take an active role in their care and improve their quality of life during treatment. Chemotherapy can have significant side effects, but supportive care aims to help patients manage these and tolerate treatment better. Symptom management focuses on alleviating common side effects like nausea, fatigue, and pain. Nutritionists work closely with patients to ensure they maintain a healthy diet and get the necessary nutrients during treatments. Counseling, support groups, and mental health services are crucial for helping patients cope with the emotional and psychological impacts of chemotherapy. Complementary therapies like acupuncture, massage, and meditation can also be very beneficial in alleviating side effects and improving overall well-being. Neutropenia is a condition where chemotherapy lowers white blood cell counts, weakening the immune system and increasing the risk of serious infections. Patients with neutropenia are more vulnerable to bacterial, viral, and fungal infections that can become life-threatening if left untreated. Healthcare providers closely monitor neutrophil levels and take preventive measures like antibiotics and good hygiene to reduce the risk of infections. If an infection does develop, it requires immediate medical attention and treatment to avoid complications and ensure the best possible outcome. Anemia is a common side effect of chemotherapy, characterized by low hemoglobin levels. It's important to diagnose anemia early through blood tests so it can be effectively managed. Chemotherapy-related fatigue can significantly impact a patient's quality of life. Healthcare teams work to address fatigue through medications, dietary changes, and activity modifications. In severe cases, blood transfusions may be necessary to increase hemoglobin and alleviate anemia-related fatigue. This provides temporary relief and allows the body to recover. Nausea and vomiting are common side effects of chemotherapy treatment. Doctors often prescribe anti-nausea medications to help manage these symptoms. Complementary therapies like acupuncture, ginger, and dietary modifications can also provide relief. Eating smaller, more frequent meals and avoiding strong smells can help minimize nausea during chemotherapy. It's important for patients to work closely with their healthcare team to find the best ways to manage nausea and vomiting. Chemotherapy can unfortunately damage the peripheral nerves, leading to a condition called chemotherapy-induced neuropathy. Common symptoms include numbness, tingling, burning sensations, and loss of sensation in the hands and feet. Fortunately, there are ways to manage neuropathy symptoms, such as adjusting chemotherapy doses, using medications, and physical therapy. It's important for patients experiencing these symptoms to work closely with their healthcare team to find the best treatment approach. Early recognition and management of chemotherapy-induced neuropathy is key to minimizing the impact on a patient's quality of life. Chemotherapy can sometimes impact fertility in both men and women, depending on the specific medications used and the patient's age. Patients may have options to preserve their fertility before starting chemotherapy, such as sperm/egg freezing, embryo freezing, or ovarian tissue cryopreservation. It's very important to have an open discussion with your oncologist about fertility preservation before beginning chemotherapy treatment. The likelihood of regaining fertility after chemotherapy depends on factors like the specific drugs used and the patient's age. Chemotherapy is a critical part of cancer treatment at different stages of the disease. In early-stage cancer, chemotherapy is used to reduce the risk of the cancer coming back after treatment. For locally advanced cancer, chemotherapy is combined with radiation to shrink the tumor before surgery. In metastatic or late-stage cancer, chemotherapy is used to try to control the disease and relieve symptoms. The specific chemotherapy regimen is tailored to the individual patient's cancer stage and type. Neoadjuvant chemotherapy is given before the main treatment, such as surgery, to help shrink the tumor and improve outcomes. Adjuvant chemotherapy is used after the primary treatment to destroy any remaining cancer cells and reduce the risk of the cancer coming back. Neoadjuvant and adjuvant chemotherapy are carefully planned with the healthcare team to optimize treatment outcomes for the patient. These two types of chemotherapy work together to give the best chance of successful treatment and long-term remission. Targeted therapies are a new class of cancer medications that precisely target specific molecular and genetic features of cancer cells, unlike traditional chemotherapy, which affects all rapidly dividing cells. Immunotherapy harnesses the body's own immune system to recognize and attack cancer cells. This can include checkpoint inhibitors, cancer vaccines, and adoptive cell therapies. Combining targeted therapies and immunotherapy can often be more effective than using them alone, as they work through complementary mechanisms to fight cancer. The image on this slide depicts the key components of targeted therapies and immunotherapy, a molecular model of a cancer cell, immune cells, and modern medical technology used in these treatments. Integrative approaches like acupuncture, massage, and herbal supplements can help manage chemotherapy side effects and improve overall well-being. Practices like meditation, yoga, and deep breathing can reduce stress, boost mood, and enhance the body's natural healing processes. A balanced, nutrient-rich diet can help maintain strength, manage side effects, and support the immune system during chemotherapy. Gentle exercise like walking can improve energy levels, reduce fatigue, and promote overall well-being during chemotherapy treatment. Regular scans to track changes in tumor size and shape are a key part of monitoring response to chemotherapy. These imaging tests provide critical information about how the tumor is responding to treatment. Blood tests can measure levels of tumor markers and other indicators that can reveal how the cancer is progressing. These lab results give us important data points to assess the effectiveness of the chemotherapy. Comprehensive clinical evaluation, including assessing the patient's symptoms, side effects, and overall well-being, provides crucial context to interpret the imaging and lab results. This holistic view of the patient's condition is essential for evaluating the treatment plan. By combining these three elements, tumor imaging, blood tests, and clinical evaluation, we can get a well-rounded understanding of how the patient is responding to chemotherapy. This allows us to make informed decisions about continuing, adjusting, or changing the treatment approach as needed. Chemotherapy doses are tailored to each patient's unique needs, taking into account factors like body size, organ function, and overall health. Chemotherapy schedules may be modified or delayed to allow the patient's body time to recover between treatments. Frequent blood tests and assessments help guide any necessary dose reductions or treatment delays to ensure the patient's safety and well-being. The goal is to provide an individualized approach that balances the effectiveness of the treatment with the patient's ability to tolerate it. Chemotherapy can have a significant impact on a patient's quality of life, but healthcare teams work hard to minimize disruptions and maintain overall well-being. Proactively managing side effects like nausea, fatigue, and pain can help patients feel better and stay engaged in their daily activities. Counseling, support groups, and coping strategies are crucial to addressing the emotional toll of chemotherapy and cancer treatment. Physical therapy, occupational therapy, and nutritional support can help patients preserve their strength, independence, and sense of normalcy during this challenging time. Clinical trials are important research studies that test new treatments and therapies to improve patient outcomes. Participants in clinical trials gain access to cutting-edge care and contribute to advancing cancer research. Researchers are continuously developing innovative approaches, like targeted therapies and immunotherapies, that harness the body's own defenses to fight cancer more effectively with fewer side effects. Advancements in molecular profiling and precision medicine allow for tailoring treatment plans to each individual's unique cancer characteristics, improving outcomes and quality of life. Completing chemotherapy is an important milestone, but the journey continues for survivors. Survivors may face physical and emotional challenges as they adjust to a new normal after treatment. Regular checkups and screenings are crucial to monitor for any long-term side effects or late complications from chemotherapy. Survivors may need to focus on rebuilding their physical and mental health through rehabilitation, counseling, and lifestyle changes to regain strength, stamina, and emotional well-being. Chemotherapy can have serious long-term effects on the body, including organ damage, cognitive changes, infertility, and even secondary cancers. Organ damage is a major concern, with the heart, lungs, kidneys, and other vital organs potentially being impacted. Close medical monitoring and management is crucial. Many patients experience subtle cognitive impairments, often referred to as chemo brain, which can affect memory, concentration, and processing speed. This is an important issue to be aware of. Certain chemotherapy drugs can also impact fertility, so fertility preservation strategies should be discussed before treatment begins. While rare, there is a small risk of developing a new type of cancer later in life as a result of the initial chemotherapy. This is an important long-term consideration. Overall, the long-term side effects of chemotherapy are serious and require close attention and care. Patients should work closely with their medical team to manage these potential complications. Chemotherapy can be an emotional roller coaster. It's normal to feel a range of emotions like fear, anxiety, sadness, or anger. Acknowledging and validating these emotions is an important first step in coping. Surrounding yourself with a support network of loved ones, family, friends, or a support group can provide comfort and encouragement during this challenging time. Leaning on your support network for emotional support is key. Make time for self-care activities that nourish your mind, body, and spirit, like meditation, gentle exercise, or hobbies. Prioritizing self-care can help you cope with the emotional demands of treatment. Don't hesitate to seek professional help from a therapist or counselor if you're struggling with depression, anxiety, or other emotional difficulties. They can provide valuable coping strategies to help you through this journey. Open communication with your healthcare team is crucial. Share your concerns, questions, and preferences to ensure your care is tailored to your needs. Don't hesitate to ask questions about your diagnosis, treatment options, potential side effects, and anything else you're unsure about. Understanding your care is key for making informed decisions. Work closely with your healthcare team as a partner in your care, provide feedback, communicate your preferences, and be an active participant in the decision-making process. Patients undergoing chemotherapy can benefit greatly from connecting with patient advocacy organizations, which provide valuable support, information, and resources. Support groups, both in person and online, offer an important opportunity for patients to share experiences, learn coping strategies, and receive emotional support from others going through similar challenges. Reliable educational resources, such as websites, books, and materials, can help patients and their families better understand chemotherapy and how to manage it effectively. Financial assistance programs and organizations may be able to provide aid or coverage to help patients manage the costs associated with their chemotherapy treatment.